Hi, we're Team 9, and we're presenting Case 9, an Itchy Conundrum. Our patient for this case is PR, a 26-year-old female who works as a housekeeper. She's presented today with a bright red, itchy, and scaling rash on her hands.
PR states that she is required to thoroughly clean 14 bedrooms and bathrooms daily. The patient typically wears rubber gloves, but recently switched to disposable latex gloves to prevent transfer of bacteria. PR indicates that her hands began to break out in a red, itchy rash after her first day of using these new gloves. Running her hands under cool water would reduce the pain, but she states that this is no longer effective. Her medication experience and social history are unknown in this case.
Okay, so PR does not have any known drug allergies that we could tell from this case. There are no known alerts at this time. Vital signs were not taken in this case, and the immunization history is also unknown. For the objective background, when we saw her at the pharmacy, it looks like PR was presenting with a bright red and scaly rash on her hands. And for a review of symptoms, PR was complaining of pain and itchiness in the rash on her hands.
The current medication list for PR includes NuvaRing, a vaginal insert taken for contraception. The directions are to insert one ring vaginally and keep in place for 3 weeks. After those 3 weeks, she's to remove the ring from the vagina and do not place in a new ring for 1 week. PR is also taking an adult daily multivitamin oral tablet for general health and well-being. Directions are to take 1 tablet by mouth daily. The start date and adherence for these medications is unknown for this case.
The indication is bright red and scaly rash on hands, most likely due to an allergic reaction to latex. The short-term goal of therapy is to eliminate the signs and symptoms of rash on her hands, which includes redness and itchiness within 2 days of treatment. There is no long-term goal because this is an acute condition. The drug therapy problem is indication needs additional drug therapy. PR needs additional drug therapy to treat the bright and itchy rash on her hands that is developed due to a suspected untreated latex allergy.
This is a slide overviewing our therapeutic plan. Our therapeutic options include hydrocortisone 1% cream and diphenhydramine 25 milligram capsules. The indication we are treating is a rash that was expected to be caused by an allergic reaction to latex gloves. While both diphenhydramine 25 milligram capsules and hydrocortisone 1% cream are both viable options, hydrocortisone was chosen as the most optimal treatment since it is considered a first-line treatment for localized allergic dermatitis reactions. Diphenhydramine was not chosen since it has a higher possibility of causing systemic adverse side effects such as drowsiness.
PR will be instructed to continue her NuvaRing contraceptive as well as her daily multivitamin. We did not make any changes to these medications. The hydrocortisone 1% cream will be added to treat the rash caused by the latex gloves. PR is instructed to apply a thin film topically to the affected area 2 to 4 times daily as needed for rash for up to 14 days, and she will start this medication today. PR should use this medication until her rash resolves.
Other interventions that we have recommended for PR include avoiding the use of latex-containing products, as we suspect her previous use of latex gloves was the cause of her reaction. Instead, we recommend she use non-latex gloves, such as disposable nitrile gloves, while cleaning bedrooms and bathrooms at work. We also recommend she does not use cool water to relieve the pain associated with her rash. However, PR may apply a cold compress to her hands to help relieve some of the pain and itching she is experiencing. When using the 1% hydrocortisone cream, we have recommended to PR to apply a thin film to her hands after showering or washing her hands because this product is water washable.
We will follow up with the patient in 2 days over the phone. We will first assess for any safety issues by looking for adverse reactions such as irritation at the site of application. Then we will assess for effectiveness by seeing if we have achieved the goal of therapy, which was to eliminate the symptoms of the rash in 2 days.